A very good evening to you. My name is Sophie Matovu. Thank you for joining me on U Health Chat. Now, today we are going to have a topic that is rather of very pertinent interest because this is something that is really happening. It's very complicated. It could happen to you and it does not regard in terms of like how you'd say that this is only among the females, but it can also happen to the men. Now, Breast Cancer Awareness Month is a month that is, that takes place every October. In the month of October, a lot of topics, a lot of discussions evolve around breast cancer. It's also called the Pink October. You might be asking yourself, why pink? We normally don the pink ribbons, to adopt to this color and display and be able to create a sense of awareness about breast health. There's something about pink. It's a soft color. It creates kind of like beauty. It speaks and says it all. So the theme this month is keeping her in the picture. I don't know why the only her, but I would think it's her and him. Gertrude is the expert on that and she'll tell us why it turns out that way. Gertrude is the CEO of Uganda Women's Cancer Support, which is normally abbreviated as UCASO. But not only is she that, she's also the founder member, because it's a very recognized and big institution here in Uganda, and I believe it has very many different women who are survivors of breast cancer in Uganda. Not only is she that, she's also a board member at Uganda Cancer Institute. Gertrude, a very good evening to you.
Good evening, Sophia.
How are you?
I'm fine, thank you.
Thank you for making time to come for the show. Now, Gertrude, of course, I know when we talk about that, I'm seeing you have a lot on your hands. Yes. As a board member at Uganda Cancer Institute, where is your core area and what committee are you? What are you pushing for? Breast cancer? Awareness?
Thank you so much. When I'm at the board level of Uganda Cancer Institute, I'm pushing the patient voice and the community. I'm pushing for change. And in the board, I chair the Change Management Committee, which has partnerships, business development, and advocacy. It's a mouthful, but it involves a lot to advocate for access to treatment, to screening, to services closer to the people, but also to bring in the picture of sustainability, business development. How can we support the efforts of government and the institution to ensure that people receive the services as and when they need them, and with quality? So that is the committee I chair. I represent the civil society organ of the country.
Okay, that's great.
Yes.
Now, I believe as a person who is, of course, around those circles, you could be having a rough estimate of how bad the breast cancer situation is in the country. Do you have a rough estimate of the statistics, or is it something like, say, I don't know?
Yeah, breast cancer is a big problem, not only in the country, but at a global level. In 2020, breast cancer became the commonest cancer around the world, and it was the commonest cancer that killed many people, putting men and women together. So breast cancer is a global interest because it's the cancer that can be easily treated and cured, but it's a cancer that kills many people. In Uganda, we have about 2,300 new cases every year. And if you put in terms of buses, I don't know how many buses would be. And we lose about 1,000 plus women and men to breast cancer. Still 1,000 is a high figure. So with those figures, we need to worry, we need to put our efforts together to make sure that we reduce these figures.
Now, I know that when you talk about that, one of the things I know that we're strongly advocating for this month, I believe, is free breast cancer screening. And I know it does happen at most of the medical installations for free. But why is it that we have to wait for it to happen in this month is when the offer is there?
It shouldn't be, we shouldn't be waiting for October. It should be through, year through. But because breast cancer is one of the biggest killer, 1 month was dedicated specifically to increase awareness, in the communities, but also to invite people who can provide the services, civil societies, institutions, hospitals. That's why you hear a lot of free screening, free checkups for women study that they don't invite men, but they should be also inviting men, because breast cancer affects men as well. Yes, but should be a campaign throughout the year. This month is to increase awareness and to ensure that we give breast cancer priority, because it's killer number 1 globally. And it's among the top 10 cancers, the top 3 cancers in Uganda.
Okay.
Yes.
Now, if you say it should be something that should be routine, do we have, or do most of our facilities, let's assume, have access to that? I'll give an example. When it comes to the issue of malaria, I think it's a song. Yeah. Maybe it's because when the mosquito comes and is buzzing around your ear the whole night, yes, you just cannot stand it. Yeah. Hence, you're having your mosquito net, and government has done a very powerful role in terms of intervention to ensure every household, every single person in the household has a mosquito net. Now, what are the preventive measures? Has that been done? Like, can I easily walk in any of the medical facilities and then I'll have breast examination done?
There is a lot to be done in the cancer space. Unlike malaria, HIV, those have given, the drums have drummed so high, and many people can now hear that you need a mosquito net and all that. So with cancer, that's why we come out strongly as advocates that the attention that is given to malaria, to HIV, is big given to cancer, and especially in this month for breast cancer. It's not true that you will walk in any clinic and get a free screening, get a free mammography, because most of these in the private facilities are at a cost, at a fee. And it's very rare that I will go to pay when I don't have pain, because we know we only go, we pay for pain, we pay when we see blood. In the government facilities, yes, midwives can do the the clinical breast exam. But as advocates, we encourage women to do breast self-examination. At least you have the breast with you every day, so it starts with you. It starts at a family level, and then you push when you go to the health facility to request for an expert breast exam. But we still have to do a lot of work. And you and me and any other person watching today is an ambassador of this message. Okay.
Now let's get to let's dig into UKASO. Yeah? How was it founded? I want to take it that everybody knows the story. That is very wrong for me to assume that everybody knows about it. You're the founder member. Why did you opt to found an organization of this nature?
It was 5 of us who had the treatment then, 2002. Because what we went through, as a patient, you need to talk to someone. There are so many things that happen. They tell you you'll have, for example, lose a breast as one of the treatment options. That one is very alarming. You can fear, you can even fail to get treatment and fail to go for treatment because you don't know what will happen. When you get chemotherapy, the hair goes off and you don't know what will happen. So what happened to us? We felt we needed to support other people to go through it. Cancer journey is not a malaria treatment. With malaria, it's 1 dose. In 3 days, you're done. But with cancer treatment, there are a lot of treatment modalities, and it will take almost a year. From one treatment to the other, and the treatments are so harsh. The treatment of breast cancer is removal of breast. That is the first option that because to ensure that cancer doesn't spread, you remove the breast. And if they say you're going to remove your breast, what comes into your mind is death. How will I cover the wound that is there? Then you'll go for chemotherapy, the hair will go off, the color will change. Then you go to radiation, you think about roasting your body. You go about for hormonal for another 5 years. So a patient going through cancer treatment needs support at every level of treatment. You need information, you need the resources. So UKASO came into existence because we realized as patients we lacked a lot. You cannot have everything as medicine. A cancer treatment you have to be comprehensively handled, psychologically, socially, economically. So UKASO came to support patients going through cancer treatment, to ensure that they stay in treatment, they adhere to treatment, and they live positively. Because we survived what we felt, what we knew was death, but after surviving, there's life beyond the cancer, and we wanted to give hope to those who are going through, and also to help the community understand the cancer, and the community understand that there is life beyond the cancer.
Oh, that is quite interesting.
Yes.
Now, how many women, do you also have men in the organization? Since we say Uganda Women's Cancer Support Organization.
Yes.
Yes. How many are you?
We are 200 survivors across the country, because it's a national organization, and all the women that we support during cancer treatment, when they survive and they complete treatment, they join us and want to give back. We recruit them, we train them, and then we deploy them where they come from. So if we have a patient in Igulu, we refer the patient to survivors in Igulu. If we have activities in Masaka and we want to sensitize the community, our champions in Masaka will lead. So that is our way of working. We are a network of survivors across the country. We have men. We don't have men survivors because breast cancer in men is terminal most of the times. And but we have well wishers. We have champions whom we work with, and we have like 50 volunteers who always subscribe to our work. I would like us to get to that bit where you say it is terminal in men. Why does it turn out that way? Because they cannot do the self-examination. It is engraved inside because they have no mold around to touch and feel that this is what it is. Yes. Unlike women, for us, our breast has a mass around it. There is fresh. The men don't have fresh. But also, it's unusual that men will have breast cancer. They will think that they have breast cancer, and they will not think about breast self-examination, go for breast screening. So it comes in late stages. Most of the time, by the time men realize they have breast cancer, it's too late. It's stage 4. And also the stigma that goes around with it, because many people think breast cancer is a women's disease. So the men, when they get breast cancer, they don't even want to disclose that they've had breast cancer, because the first thing will be, you have a women's disease.
What? That's what they are told?
That's what they are told.
Excuse me.
And it stigmatizes them a lot.
Oh, wow. Now, what are the signs and symptoms? You know, because for somebody, since me and you have set out to wear our pink ribbons, and we intend to sensitize the masses during this period of the Awareness Month, what are the signs and symptoms that somebody can quickly look out for? Because when they self-examine, how is it done for somebody to know that this is the right way to do it? Or some people just even get alarmed without knowing that this is how. There are certain times we don't know our actual body.
Yes.
And somebody will get alarm bells on and think that now this is it, I am dead, I am finished.
Normally what I advise people is not to wait for the signs and symptoms. Well, it's good to look out for the signs and symptoms, but at times the signs will come out when it's too late. I want to encourage our viewers that we should have these routine checkups. Routine, if you are of a certain age, 35 years and above, you should be able to go for a mammography, you should go for a breast x-ray, a breast ultrasound scan. But now that the breast is outside and you can always look at it, we encourage women to always examine their breast to know, first of all, to know the normal. What is normal for you? So when you start as a young girl, you know your breasts are normal. This is how they look like. So if anything happens, then you are able to tell this is abnormal. The commonest sign is a lump that is not painful. It may be anywhere in the breast, anywhere closer to the nipple, towards the armpit, towards the collarbone. But so if you always palpate your breast, check it, touch it, not in clothes, but when you are not dressed, you should be able to feel that your breast is smooth and doesn't have any swellings inside. But the day you hear something maybe as tiny as a bean or a coffee bean, it's not painful, but it's very hard as a stone, that is something that you should report to a health worker to check and confirm, because there are so many other swellings in young people that may not be breast cancer, but to rule out that this is not breast cancer, somebody professional should look at it. But also having discharges in the nipple, it may be blooded, it may be water, that one also should be reported, because you cannot just look at this and confirm that is breast cancer, but you need to go to a health practitioner who can recommend, maybe take a sample out of it. But also, normally when you remove a bra and stand in front of a mirror, the nipples will come out, they will point out. But if the nipples start pulling inside or facing another direction, then that should be a warning sign that something is inside is pulling your breast. So it should also be examined to confirm that's not cancer. But also the nature of the skin of our breasts, the surface, normally it's smooth like the rest of the body, but at times the skin starts changing like to an orange peel, kind of starts in one place, and then the entire breast starts changing the skin of the breast. So, and this should be done regularly, maybe monthly. If somebody is still menstruating, after the menstruation period, then you should be able to look at your breasts. If somebody is already in their menopause, choose one day in a month and they critically look at these breasts. And at times, because we are so busy, you wake up, you bathe, you don't even have time to look at yourself. But if you chose one day and dedicate it to your body, especially during this month, you say, this day I'm going to examine my breasts and look out for anything abnormal. Then when it comes out, then you should be able to report it.
That is, by the way, what you're saying is very true. Now, there's some myths and misconceptions that the public has out there, where they think if you have, you're more at risk if you have bigger breasts. How far true is that, of getting breast cancer?
No, it doesn't matter. It doesn't matter the size. There are those with very big breasts. There are those with very small breasts. I think the risk is not in the size, but the risk is in the exposure. What is your exposure? If you have a history, genetic exposure, if you have a history of somebody like a sister to me, or my children, or my nieces, because that is already a risk to my relatives, that if you have a first-degree relative or a distant relative who had breast cancer, it's likely that you have the same risk. So it's important to watch out whether the breast is small or big. But also there are exposures in terms of the environment where we live, the food we eat. No, we are in an industrialized world today with a lot of chemicals, from cars to industries. So those exposures also increase our risk. But also we have a risk on the, if you are overweight or obese, you don't do a physical exercise, then the risk increases with the amount of weight that you gain as entire body. But also those who have not had children, but also those who have children and they don't breastfeed, also it increases the risk. So it's a combination of different factors that bring one person to a risk of developing breast cancer.
Now, what about when it comes to like the certain times, the type of bras people wear, because you know they like looking sexy, then they wear their push-up bras and then they're all looking, hey, yeah?
Yes, I don't know whether, now that I'm not a researcher to have researched there, but it also may be a myth. But of course we need a comfortable bra, because you exert a lot of pressure on the breast by pumping it. The uncomfort, you never know what happens. Maybe it may also increase the risk, I don't know. But one should wear a comfortable bra where you are really comfortable, because I'm sure some of the bras, because of the style, but you are not comfortable. At the end of the day, you have pain all over because you pushed the breast up there. Yes.
Now there is now let's get to Ukaso and your activities that you have around this time. First, I find wondering about the theme, keeping her in the picture. That That's a theme one might not give much attention, and they're like, okay, what has that got to do? Is it to the caregivers? Is that to the medical persons? Who is the theme addressing?
Yeah, the theme is keeping her in the picture is all of us. It depends in the context. Her, we are looking at the breast. Who has that breast?
Both the male and
Both
the
the
female.
male and the female. So we need to keep them in the picture. At times we talk to ourselves. At times we do things. If I'm a policy maker, I don't know what is happening in the other side of the world. So we want to bring out that if we are talking about breast cancer, who is that person we are talking about? Is the information we are giving out, does it reach that person? If we are planning, we are making a policy for the patients, for the community, are they in the picture of this policy? Normally we make good policies if we can go into talk about them, and they are good, very good, we put them on shelves and they are never implemented. This year we really want to have programs that are really keeping everyone in the picture. If you are talking about breast cancer, is the midwife at the health center aware that if a mother came in and they wanted a breast self examination, is she able to do it? So we need to keep everyone in the picture, but the context will move with the needs. But also this woman who has the breast has to be in the picture. She needs to know when we do these awarenesses, how does a person in the rural area know that she needs to check her breasts? Needs to know that when there is a problem, this is where she's going to get the services. So that is the theme.
Oh, wow. Interesting. Now, about the activities, what activities do you have around? Because there are times we might talk about it, we might be using the mass media to pass out the information, but how do you get to the woman down in the grassroots?
First of all, I want to thank UBC, because UBC reaches everyone. When I'm on UBC, I get calls from Gulu, from Chisoro. So being on air is one way of reaching the woman on the grassroots. We are intensifying awareness through TV. I pray that we get another program before the month ends. And then we can talk to many as possible, but also we engage the public. Tomorrow, Friday, we have a dance workout. We really want to show that we can prevent breast cancer through exercise. You know, you can do breast self-examination, you can do everything, but also you need to demonstrate that you can work out. So tomorrow is a demonstration at MTN Arena. We shall have to dance from 6 to 9 p.m. and with just a kit of the entrance fee is 20,000. So we dance out, but before the dance workout, we have a screening, a free screening, and I want to encourage everyone who is in Kampala. We have Uganda Cancer Institute team with us, and they'll be there to screen breasts, to screen cervix, and then prostate. So whoever is around, screening is free. There's no pay for it. Information is free. The survivors will be there to share their testimonies and information, and then all the questions will be answered.
Wow, that's quite interesting. Then, because you say you have ambassadors in the different, regions.
Yes.
What plans do the ambassadors have there? Because it looks like this MTN Arena is going to be the hub of all the fun. Then what's going to happen in the regional center, in the regional areas?
The regional areas, we have not planned public activities, but at least we encourage our ambassadors wherever they are, where there is an opportunity. For example, the local radios, the local TVs, they can still go and educate the nation. They are intensifying hospital visits. We have a very strong team at Lacho Hospital. They do hospital visits. We have some ambassadors in Imbarara, we have ambassadors in Masaka, so they are going out to reach the patients. Yeah.
Now I'd like you to take us into an ideal day at Ukaso, because of course it's not a medical center.
Yes.
I know women come there for psychosocial support as well,
yes,
because it's not only for the survivors, but I believe even for some of those who are struggling with breast cancer. What's the typical day like?
A typical day, when you come to our office, it's like a clinic, because people come, and most of the time they come for information. Information, counseling, they come for requests for food. You know, currently Uganda Cancer Institute is the only treatment center providing comprehensive cancer treatment services. So when the patients are referred from regional centers, then they come expecting to be treated like as you treat malaria. But you come, you don't know that you have to stay for more than a month. You don't have anywhere to stay. You don't have the food. Nobody has prepared you that you will need so many investigations before actually the treatment starts. So when they get into the clinic, they are written about 5 tests. You need an X-ray, you need a CT scan, you need all these. And then they've only come with the transport. So then they start looking around. So the nearest place they go to is Wokaso. I have all these tests to make. I don't have this money. I need to call home, somebody to sell a goat or to sell a matoko, sell land to send the money. So as they wait for the money to do the investigations, they have nowhere to stay, but they have also they have no food to eat, because they are not yet patients of Uganda Cancer Institute. So we have that challenge, and on average on a day we receive about 3 to 5 patients coming to us with the different needs. So we do psychosocial support, but the needs are beyond the you'll be okay, because you need really to provide. And now our plan is to have a rehabilitation home, a home of hope, where we can prepare them, talk to them, but also help them make decisions whether to sell land or to sell a goat, so that when they come, they can be somewhere as they wait to complete the checkups and they start on treatment.
So some of this I can imagine get close to you or members of the organization. Then when they are enrolled and they are able to succeed to become patients at Uganda's Cancer Institute, do you still go there to check on them?
Yes, we do. We do. We have survivors who go to Uganda Cancer Institute. Surgeons who invite us, because at times when they are going for surgery, at times they don't know what is going to happen. So the surgeons invite us to talk to them before they go to theater. Before they start chemotherapy, the counselors and social workers invite us to talk to them. When they start chemotherapy, then they invite us to talk to them. So we are even limited with numbers and resources. Otherwise, we would need like 10 counselors every day. But because we don't have the resources, most of the time our survivors use personal resources. We are not funded for this work. Most of the time we use personal resources. Individuals donate. We get a lot of good people donate to us to do that kind of work. And you find you need, and once they start the journey, at every stage of the journey, there are new issues. This person needs support continuously, otherwise they won't adhere to treatment. And it's on record that about 40% of patients don't complete treatment. When they start, they take 1 dose or 2 doses, and when they go back, they don't come back, because their issues are not clearly addressed, information is not clearly provided.
Then is there also a possibility that some of them will not adhere due to the nature of treatment that it is? Are they given, or let's use the years back for you, the survivors, were you taken through a thorough counseling to tell you what to expect as you're going to go through the chemotherapy?
No.
Oh, wow.
I think WOCAS exists because of that. I was as ignorant as even people are ignorant today, because the assumption is that when you have cancer, within a month, you will have all the treatment finished and I go back to my work. But cancer treatment is not like any other treatment. So before any patient starts treatment, they need to be taken through. And this concern is not only for the poor, not only, but the rich fall victims. Because You work here in UBC, when they give you the news, you withdraw your salary in the bank, you get on a plane, you go to India thinking that you will have treatment in 1 month and come back and work. So we need to prepare the patients that these are the stages, this is what you need to do, this is the resources you need. Then you plan and then start the treatment. So patients have not got an opportunity to be prepared for this journey. And that is what we do. But what we is a smaller contribution because most of the people don't receive our services.
How would you like to be helped for people to be able to easily access your services? Because, you know, having gone through that experience,
Yes.
you're the best person to talk to somebody about it.
Yes, so I think first of all we need a space. We need the space. We have a very small office. We need a space that can provide the counseling space, but also accommodation. So that when they come in, we are able to talk to them today and tomorrow. And if somebody has come in, somebody has come from Chisoro and didn't expect to stay here for a month, then that's why you find them wandering around the hospital corridors.
Yes.
They
And
are
sleeping on the verandas.
Sleeping on the verandas. If we had enough space and if there's a well-wisher who can donate a building, I'd be more than happy. Or support us to start small as we can, so that when they come in, we can talk to them. We can invite all the survivors we have in Kampala to give the support. We are also limited with the counselors. You get drained. And also we need to support ourselves. So we need the space, but also we need the resources. Because if we have a place, we need beds, you need beddings, you need saucepans, you need something to keep us moving. Because some come hungry when they've not eaten for 3 days. Ever since she only came with the transport, and she has been wandering around with nothing to eat.
Oh wow, that's really like sad. Now, in terms of the people you have dealt with, or some of the people you have, what can you say has been your worst moment? I believe sometimes there's some of those where I know you're a very busy person because you have also other responsibility at the Uganda Cancer Institute, but then at this time you are called in to practically also intervene. And why did it turn out that way?
The worst moment is having this person in front of you. You see the disease is early, but this person cannot continue in care. As I mentioned, somebody comes in even cannot afford an X-ray of 10,000. Has sold all their property to come here, and the money is all taken into transport, accommodation, food. So you see this person struggling to initiate into treatment, and they delay for maybe 6 months.
Or as the disease progresses.
So when they start treatment, they say, oh, sorry, your disease, which was stage 1, is stage 4. That is heartbreaking. And you look at this lady came early, and they say all our efforts, because we do so much to mobilize communities, to go for screening, and this lady has gone out to a health facility. They said you have a lump, the lump is removed, they've confirmed the cancer, it is stage 1, but between the diagnosis and the actual starting of the treatment, the person has stage 4. And it's so disappointing to the patient, and when this health worker sits and says, oh, I'm sorry, your disease is stage 4 and it's incurable. That has been heartbreaking for me.
And because at what stage, now that you have actually even said it, do you at any one point refer some of them to that, like if that person is at that stage, do you refer them to a hospice, or how do you go about it?
Well, we don't have the mandate to refer, but at least we guide. At that stage, we work with everyone. For us as advocates, we engage, where there are a fee, we really request for waivers. If there is a fee and this person has to contribute, we see they are really can't afford, we request for waivers. But my advocacy is to have the services closer to the people. If the services were closer to the people, if there is a center that is functional in every region, these people would not spend money on transport and accommodation and all of that. So they would receive services where they are. So the money they would have used into transport,
yes.
100,000 to Kampala and accommodation would be used for an X-ray, and they'll be closer to their people. Somebody would carry the food and bring it in Mbarara. Somebody would bring the food from Gulu and bring it. The other than somebody coming from Arua to Kampala, you use 200,000 to come and you need to feed. So you spend about $1 million shilling just in there. But you can't even afford an extra of 10,000 because you've spent the money along the way. So my biggest cry to government is to expedite the functionalization of the regional centers.
Okay.
Yeah.
So far, it's only here. We don't have any other regional centers that are up and running in line with cancer?
We do. Mbarara is running, but not fully because some of the services are not there. Gulu has just opened.
At Lacho Hospital?
It's a Gulu Regional Cancer Center. It's a separate government center under Uganda Cancer Institute.
Okay.
And the Arua is operational to the level of screening and maybe palliative care, and then Mbale. So still many patients are still referred. So how about the people who really need the services, and the services are only in Kampala?
Then what is the plan for the young girls? Because you know there are certain times we believe, like you say, and the perception is as long as you're 35 and above. What are the chances that the younger ones are safe?
The young ones are not safe because I got breast cancer before 35. I was 28. So, and I see a lot of young people in their 20s getting breast cancer. So in our programs, we engage schools. We give awareness in schools so that these young girls start understanding that the disease exists and it's not for the elderly. Because even me, I thought it is the old women, not knowing that I can also get it. So we have plans and programs for schools, both girls and boys, so that when they adopt the culture of routine screening, understand the disease is there, and these are the signs and symptoms. So, but by the time they grow, it's part of them. They are in the picture.
Yeah, true.
Yeah.
Now maybe let's dip a bit into the color pink. I know it's the global color that they are using.
Yes.
Tell us a little bit about. I believe you have done.
All of us. It's either a source of food, it is either a source of pleasure, it's a source of beauty. So when you see the pink ribbon, then you know it is talking about that beautiful part of the body, the breast, and we need to care for the breast health. We need to ensure that the breast is healthy, taking care of it, whether it's yours or somebody else, if your husband or your wife, we need to take care of that beautiful part of the body.
Okay. Now you did talk about what we should expect tomorrow. The dance, yeah? The workout, the free screening.
Yeah.
What happens after tomorrow? I see the month is still midway.
No.
We're getting to midway. What is going to happen thereafter? Take us into your awareness plan as Ukaso for the remaining days of the Pink October.
We have quite a number of institutions that have invited us to give talks. Actually, tomorrow morning we are giving a talk to East African crude oil pipeline staff. So any other organization can book us and we talk to the staff in depth, ask questions, talk about the signs, talk about the symptoms. So we are engaging at that level, schools, institutions. We are going to have media engagement. We are going to be more in the media. Tomorrow is like the launch of the month. We want to let the world know that of course there is life. You will see a lot of survivors. There is life beyond cancer treatment. Beautiful ladies. So you only come in, you have to come and see how beautiful the survivors are, how young they look. And also to emphasize that physical exercise is important. So we want people to exercise throughout the month. at the individual level, at the institutional level. You can also have your workout here at UBC. If you can't come in, you can deliver the kits, and then you do the workout here. Yeah.
Then how do you allay the fears of, like somebody imagines just the thought and the idea of like, yes, I have to lose the breast. How have you been able to convince women, some of them who have survived or who are living with breast cancer, that that's the way to go? If the doctors have diagnosed and to prevent the spread, this is the intervention that needs to be used.
Yeah, it is. It has been a big challenge to talk to women to let their breasts go. The biggest fear is, how will I look? Because we mind a lot of our self-esteem, our looks. As an organization, we provide artificial breasts and a special bras. So as long as you tell a woman that there is an option, when you lose a breast, there's something that will make you feel like me, you can't know. Because you'll be smart, you'll wear your clothes and go. At least that one can allay their fears of losing breasts. But it's still, the stigma is there because the worry is, what is going to happen to me without a breast? How will I look? How will I go back to work? Because when you tell people that I have one breast, they turn it twice to confirm. Yeah.
Then I know for a fact that some of the other countries will go an extra mile of, if somebody has finished going through all the cycle, and every after maybe like 3 or 4 months, they have to go and keep testing again to see that the cancer doesn't reoccur. What was your situation like?
It's the same situation. The way cancer is treated elsewhere, there are international standards that are followed everywhere.
Okay.
So when they say after treatment, you go every 2 months, every 3 months. The first 5 years were really intensive routine checkups, and I completely complied with my routine. I think that's why I'm leaving. It happens here, but most of the time, and I think I give this information to most of the survivors there, most of the time, once somebody has finished treatment, they don't want even to go back to hospital, and that is dangerous. That is very dangerous, because cancer, as I mentioned, is not treated like malaria, that the parasites out of blood. When you finish this aggressive treatment for 1 year, there is a maintenance treatment that they may put you on. Most of the times hormonal treatment for 5 years. Some people even stop it. I feel okay, I'm okay. So 3 years later, then something pops up. And when it comes back, when you had your treatment halfway, that is now disaster. So all the patients are given appointments to keep coming. Some intentionally don't, but others, because of the issues, as I mentioned, somebody suffered through. Every time you came for treatment, you had to sell a goat, you had to sell your land. So when you finish treatment, you say, oh, now let me get back into my work. I don't have transport. There are those who don't even have the transport to come back for review. And by the time they come back, the cancer has recurred. But maybe because the treatment was not was not completed, but also not complying with the routine checkups.
Oh wow, that's rather sad. Oh, that's really you think about it and you're like, wow, this shouldn't be happening to people, because information is something that is very, very important once they take. Then are you also making an effort to translate some of this beautiful information to the lay person down there? Because at certain times, people are advantaged. If you're watching UBC, yes, you're getting the message direct in English, and Gertrude is here. But what about the people down at the grassroots?
Yes, it has not. We have, to some extent, Uganda has how many languages? There's so many, but there are those major ones. Yes. As I mentioned when I was starting, that we have not had resources. Cancer space in the NGO world, we have not had partners that have come out to support. I think when we talk about HIV, people will put in all the money to translate, you see big billboards, but you never see billboard in Kampala talking about breast cancer. people, we always talk to partners, to institutions, can you at least support on materials, on messaging? The interest is not there.
Oh, sad.
So we only reach those we can reach. Now that UBC has a Uganda translation and the other dialects, maybe you can talk for us to get more airtime to use different languages. But we appreciate their media houses that have provided airtime, UBC Star, and we have reached those who can hear Uganda. But also we have translated some with the ministry. But in terms of cervical cancer and HPV, we did some work and we translated some messages with the support of UNICEF.
Oh, okay, that's nice.
Yeah.
Okay, what is your take-home message to a person watching you right now about Breast Cancer Awareness Month? I want to encourage everyone who has a breast to take personal responsibility. You know, the breast is yours and you have it every day. First of all, you should know it's normal, how it looks like when it's normal, and then you should like it and then check it. You know, I ask women when I go in the community, they've never looked at their breast, they don't even know how they look like. Shower, get out of the bathroom, dress up. Some of them actually don't even have a mirror, so they might not even know what their breasts look like.
Yes. But it's just taking personal responsibility for your breast health. And also to know that everything that is in the breast is not cancer. So it's always important to have what you feel like abnormal checked by somebody professional, so that at least you allay those fears of saying maybe it may be cancer and you keep it to yourself. But also I want to encourage those who are on treatment to adhere to treatment. And those who have completed it to treatment to continue visiting their providers, so that to check, otherwise something may come up and by the time you're going to be too late.
Very true.
Yeah.
Gertrude, thank you so much. We cannot take it for granted. You're a very, very busy lady. To get you here in studio tonight, we say thank you so much for your time, and thank you for creating awareness and for standing by the survivors as well as those who are struggling with breast cancer and their families. Well, surely that is all we had for you tonight. Gertrude has been a very wonderful guest on set. We look forward to possibly going to check out what will be happening there tomorrow, and we might be able, with her support, to get some of the testimonies of some of the other survivors and stories that we might be bringing to you in UBC studios for you to get to see more about that. Well, that is all we had for you tonight. It is good night from me and Gertrude. Keep watching UBC TV for Michael Jordan Lukoma is coming your way with the 10 o'clock news.
UBC, inspiring Uganda.